The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar featuring the 2018 Delta Omega Innovative Public Health Curriculum winner and an honorable mention for the award. Today's webinar will be 1 hour in length. We will begin with a short introduction of our presenters, followed by their presentations, allowing time after each presentation for a few questions, and concluding with additional time for questions and discussion. This webinar is part of the 2018 ASPPH Presents series, and it is being recorded and it will be available on the ASPPH website in the archived webinar section soon. All registrants will receive an email with the link to the posted recording and slides when they are available. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note. While you are in listen-only mode, your lines have been muted. We encourage you to ask questions throughout the presentation by using the question box. We'll address your questions after each presentation and also at the very end. We're pleased to have with us our two speakers. The first speaker, Dr. Christina Rose Welter, who is representing the Delta Omega Lambda chapter at the University of Illinois at Chicago School of Public Health. She facilitates practice and academic partnerships to build on the strengths of people, organizations, and communities to understand and collectively create innovative and enduring change. She serves as Associate Director of the Doctorate in Public Health Leadership Program at the UIC School of Public Health and is the Director of the Mid-America Center for Public Health Practice. At UIC, she helps to lead one of the nation's only doctoral programs in leadership and oversees several national and regional workforce development and practice-led research initiatives. Our second speaker, and the winner of the Delta Omega Innovative Curriculum Award this year, is representing the Delta Omega Alpha Pi chapter of East Tennessee State University College of Public Health. Dr. Mike Stutes received his Master of Public Health from East Tennessee State University and his Doctor of Education at the University of Tennessee. A lifelong resident of Northeast Tennessee, Dr. Stutes has devoted his career to serving the community and improving education. He has taught public health for over 20 years, focusing primarily on undergraduate public health education. His research interests include public health education methodology, teaching creativity and innovation, and health in low-resource settings. His background includes construction management, political consultation, and scuba instruction. Thank you both for being here today, and I'm going to turn it over to Christina.
Thank you so much, Sarah. Can everybody hear? Can you hear me okay, Sarah?
Yes, you sound great.
Great. Good afternoon, everybody. I'm Dr. Christina Welter. I first just want to say thank you to Delta Omega and to ASPPH for this opportunity. While as faculty, we put a lot of time and energy into teaching and to developing our courses. It's not required to be acknowledged, but it's always nice. Before I begin, I also want to acknowledge my colleagues in the DRPH program here at UIC. While I was the lead developer of this course and am the primary teacher, instructor, it was supported by a wonderful group of team faculty that I work with. In addition, our DRPH students, who are all full-time practitioners, contributed to its development over the past 3 years. And so while I can't see if any of them are online right now, some of them are unable to join us, I just want to acknowledge their participation as well. So today, I'm going to be sharing a little bit, just one second here. There we go, thank you. Today I'm going to be just talking a few minutes about our DRPH program in leadership to help frame the context of the course development, and then talk about the course itself, which we call Engaged Scholarship. So we're all familiar with public health impact in the 20th century. It was remarkable. Well, we were able to contribute to a 20-year increase in life expectancy thanks to public health interventions like the use of seatbelts through seatbelt policy, immunizations, and tobacco control. Today, however, we are faced with far more complex public health issues than ever before, and profound inequity. So much so that just a few miles in where one lives can mean a 15-year difference in one's life expectancy and our health outcomes. And it's no wonder. These two pictures that you see on the screen are from my former jurisdiction, where I was the Deputy Director of the Cook County Department of Public Health, where you can begin to see where access to places to play and access to healthy food are few and far between. Cook County has some of the poorest and the wealthiest individuals in the nation. It's no wonder that there are tremendous disparities in health outcomes for chronic disease. And adding to these root causes and public health issues, addressing these root causes and public health issues is incredibly challenging. There is no one solution. There's no one fix. And every time we do fix one thing, another problem might emerge. With fewer and fewer resources, including funding and staff, increases in our requirements through grants or just in accountability, sustainable change is really difficult. It takes many experts and indeed many leaders working together to impact change. The DRPH was created in the early 1900s, I think it was 1919, to address these challenges in public health, specifically in practice. It was designed to help build and use evidence for decision making. A call for leadership in the DRPH reemerged in the late 20th century from multiple Institute of Medicine reports. The DRPH has always been about building and using evidence in practice, but this reemergence of the call for the DRPH, and in particular of leadership, had a heavy focus on evidence building. Graduates should be prepared for evidence-based practice and generation of practice-based evidence, and that we should be graduating with the skills to identify and leadership to apply evidence-based interventions. Our UIC program was one of those responses to the call for leadership and the calls for the DRPH program. We are one of the only ones in the nation to focus specifically on leadership and scholarship of leadership in building evidence and practice. Our mission is to build a cadre of senior public health practice leaders who can drive change, develop policy, build systems, foster innovation, and contribute to the evidence base of public health practice. We have nearly 100 students that work at mid to high level positions across the nation and across the world. And they are employed mostly full-time so that they can take the information and the knowledge that they learn from us, that they learn from each other, and apply it in practice so that they can learn even more. We really take a bent on providing them with theory and methods, and our curriculum is one in which that builds off of each other through each year of the program, starting with Bloom's taxonomy, helping the students to build their knowledge of adaptive leadership, build their knowledge of research skills, moving into the application and use of those skills, and then eventually they're adapting what they know and integrating it into their practice so that they are fully competent leaders able to replicate what they've learned in their own practice and organizations and community settings, thereby helping to improve sustainability. Our primary model is looking at employing systematic reflection in these action learning cycles and practice, where they take the knowledge and apply it to the problems they're finding and cycle through many attempts to explore the root issues and causes, bring people together to address those problems, and hopefully create change. The course that I submitted this for Delta Omega we call it IPHS 512, sits in the middle of this scaffolding of Bloom's taxonomy. The first year is spent, as I noted, building the knowledge and understanding of adaptive leadership and of core DRPH principles and skills and methods. While they move up through the program, applying those. 512, which is exploring complex change through research methods, is a time in which the students' philosophy on research, their paradigm on research, as well as their early research skills start to transition. And they are better able then to adapt and start critically thinking about who they are and how they're going to employ research skills in their practice experiences. It comes in the second year of their program, nicely placed, and so that they can begin their transition to that application stage. The focus in 512 is on evidence building, but it puts pressure on and tension on what is the definition of evidence. Ross Brownson would define evidence as the available body of facts or information indicating whether a belief or proposition is true and valid. Sounds pretty familiar. It represents, that definition of evidence represents what we know true in public health for addressing the science base for public health. Employing empiricism, employing objectivity, and employing control. But some would say, as Lawrence Green here has, that maybe that definition of evidence needs to be expanded. Maybe we need to take a look at where we're building evidence and how it is defined. That at times these complex problems that we're dealing with can't be controlled. And indeed, the communities and systems in which we work have assets and unique perspectives and different definitions of problems that we need to more deeply understand. And indeed, if we don't start building evidence in practice, perhaps everything that we're developing outside of practice might have a less chance of being implemented. And there are two reasons I'm going to focus in on that were the premise for building our class, IPHS 512. The first was really asking the question, where does the research begin? The traditional pipeline from identifying the research funding, identification of the research questions, starts in academia or starts inside, quote unquote, the ivory tower. You can see here one of the most common dissemination models places practice at the very end of the model. If we begin with practice, dissemination, and implementation at the very end of the model, not only are we too late, but we've lost enough potential opportunity to really embrace the practitioner's already deep knowledge and expertise and assets of its community to address the situations. And so we seek a little bit more of an iterative, engaged process from the front end, not at the back end. The second thing that we want to think about is, where is the research problem being defined, and who is defining it, and how is it being defined? Much research, especially recently, talks about the need to go beyond just the individual level or even the interpersonal level or organizational level of the social ecological model. It is indeed unreasonable to expect that people will change their behavior when there are so many other forces impacting that behavior's decision-making process. And most research, and indeed 2/3 of research, describes interventions that only are focused at one of these levels, and most of it's focused at that lower individual level. If we instead look across the levels to look at the various powers and pressures and impacts on the social norms and on the policy and system sphere, we might have a better opportunity for creating sustainable change. And it is with those concepts in mind, beginning research in practice and defining it in practice, and looking at the multiple levels across, up and down, vertically and horizontally, that we have developed what's called systems action research, where you can see perspectives and connections within and across these socio-ecological levels to expose the opportunities and levers of more sustainable change, and that you're learning in action and in practice. So it's adapting the action research design for a more systems-oriented perspective. And in particular, this course hones in on what we call the pre-understanding phase of action research. Pre-understanding is a less-known concept in which we expose and look at these definitions of and perspectives and underlying power dimensions of the problem and how we define the problem. And so it is this look phase in the plan cycle of action research that 512 begins, so that students can really spend 16 weeks unpacking and appreciating and working with others and their colleagues and their other community members to decide and look at what is really the research question. And so with that in mind, we have adopted and adapted our own model because there wasn't one available in terms of this pre-understanding phase. And it allows the students to go through this time to really employ what we're calling a leadership approach to scholarship building, that they have to, adaptive leadership calls for bringing multiple experts, and experts in this case are practitioners, together to better understand the complexities and then pick a focus, which would be your research issue or research question, for moving forward and generating change. The class is also built to help build the readiness of the students in their dissertation and research preparation in practice, because we're asking them to rely on their own paradigms and their own philosophies, and begin to practice what it means to gather evidence, analyze the evidence, and use it with others. And the course objectives really focus around then that paradigm shift. What are the philosophies of the student and of what they think around science, and what are the assumptions that they have embedded after what have become decades of their work? They then, based on their change in perspective on what is science and what is evidence building and what philosophies they have, they employ an environmental scanning process where they understand more deeply what some of these opportunities and challenges and problems are in practice. They analyze that information and begin to develop and articulate these underlying assumptions to the problem and start to expose where those levers of change might exist, therefore developing a conceptual framework that may explain the theory around why change is or is not or could happen. The course is broken down then into these 3 phases so students can cycle through action learning within each one. The phase 1 is focused on their philosophy and their paradigm on science. This takes quite a while as they really unpack where they come from, what their strengths are, how they've been trained, and how they might think differently. There's no right or wrong, it's a spectrum, and it is an opportunity for students to see different angles and perspectives on how research is conducted. The phase 2 is where an environmental scan is conducted around the student's interest of inquiry, talking to multiple sectors, multiple stakeholders, and analyzing that information. And phase 3 is where this information comes together. And each of those then phases, there are a set of about anywhere to 5 to 6 core individual classes where either I present or I bring in outside speakers or former students come in and present. We also work in a cohort community of learning approach, which is key to our program. Each cohort is about 15, and they work together throughout each of these weeks to reflect back what they're learning in a mini cycle of action learning itself. Then they also have a community of learning in which they're unpacking their own individual problem statement with their colleagues to get additional feedback. So they cycle through these 3 phases in that multiple kind of tiered level way for action learning. And you can see that in this image where the yellow, pink, and green cycle is the reflect phases 1, 2, and 3. But at the bottom, we have these multiple rounds of action learning where students are going through systematic reflection processes to understand their problem and their lessons learned with each other, within their cohort, and within their community stakeholders. And ultimately, the goal then is to have identified a focus, this theory of change, that's focused around a research problem that connects to a systemic, has a systemic connection, a policy connection, a structural connection to an adaptive problem. And by exploring and exposing that narrow research problem, we can begin to understand what the levers of change might be for this change. And that becomes the leadership implications that help to identify how decision-making can change based on the findings from the research. I started to allude to this already. There are 3 assessments in the class. The communities of learning are one of the core third, where the dialogue is vital with their communities of learning and in their cohorts and within their team that they're working with to identify their problems. They post 10 systematic reflection journals that respond to the week's theme to help promote their own individual systematic reflection. And then they go through the 3 phases building a research paper that is essentially their chapter 1 of their dissertation, or the first version of that, where they build on each of those phases to build on the information they've collected to end then with the focus of a draft research question. And just one example of the changes that emerge through this program that show you the very technical approach students often walk into, the original definition of evidence, is on the left-hand side here, you can see a student who is interested in a very technical angle around the use of and the kind of ability to use health administrative claims data as a promising source of chronic disease information to help identify this perceived gap in public health chronic disease data. And the questions that were asked here by the student when they started this class were really heavily technically focused on, can administrative claims data be used to examine trends in chronic disease? Lots of, can they be used to assess the quality of care? Very, very removed from practice, very non-sort of change-oriented, non-policy-oriented, very technically focused. After going through the class and really thinking about what are the needs in practice, the research problem in question switches to asking the question, given public health's new role post ACA and healthcare transformation, does public health have the necessary ability, capacity, and access to this data in the first place? So we backed up the problem from, can the data be the focus? Can the health departments, can the practitioners, do they even have the capacity to do this? So they've moved upstream and they've moved more toward a practice-based problem that, if exposed, can identify, it can then research can expose the opportunities for what infrastructure might need to be put in place for the ability for public health to transition to its role. So it's a switch from a very technical, non-practice, theoretical-oriented approach to one that is still heavily influenced by theory, but one that is practice-driven and that has policy implications should we be able to identify those capacity needs. Some of the lessons learned in the class is that 512 is as much of a philosophy of thinking and learning as it is a method to build a research agenda. And so, as I've been alluding to, that students come in with strong ideologies of public health science and what that looks like. And so it's helping them to realize that different perspectives, community-based work, systems-based work, can really help us understand complex change. The second thing is that students often don't have time for systematic reflection in their employment. And so if we slow them down just a little bit, they actually are able to identify far more resources, far more existing data, existing evidence that then can be used for decision-making rather than generating new data. And so building that practice in the students' fields remains challenging for them and for us. We live in a world in which decisions are required at a fast pace, and we're asking folks to slow down a little bit and really align what they already know and what's available to help influence those decisions. And lastly, students continue to desire a way to apply evidence building in practice. How do we use this model that we've created in this class in their practice world? Because taking the time to really understand more deeply what is going on in practice and expose those opportunities, it can be very challenging for them. And they're very eager to continue this and really want practice to be influencing how academic paradigms look at evidence building. And last but not least, that is the conclusion of my presentation. I just want to acknowledge, as I said in the beginning, my team here on the lower right. This is our core faculty of DRPH members, and each of us have experience in practice and in academia where we bring the two together for hopefully sustainable impact. And with that, I'll close my presentation and take any questions and turn it over to Mike.
Thank you, Christina. I want to remind all of the attendees that they can submit their questions via the question box at any time, and we'll deliver them to the speakers. We'll take a question or two now and then save the rest for the end of the presentation after both presentations are complete. First question, Christina, is what has been the general feedback from students after taking this course?
I wish they could answer that question. I can report to you what I've heard from them anecdotally and in the course evaluations. That really it's this transition that they remark on, is that they now can see so many other opportunities for how they build evidence in their practice and how research might be defined. They, I believe, are empowered to become more practitioner researchers, and that they can use and build evidence in their work more readily and more ably. I think the second thing I would just say is many of them are quite frankly excited to make movements toward their dissertation. But I've raised the first point to say that they feel that the old paradigm was that practitioners aren't researchers and they shouldn't be. The new paradigm is perhaps they're a different kind of researcher, a practice-based researcher, and they can use and add to the evidence base of public health. So they're empowered to continue on with a practice-based research project in their DRPH work and in their field.
Great, thank you. And then the other question we'll take before moving on is, this person notes that you talked about phase 1. Can you clarify or go into a little bit more depth about what types of assignments or discussions are associated with phase 1?
So the assignments are the same through each of the cycles, and I rushed through that just a little bit. So each week for each of the phases, students are posting Blackboard systematic reflection memos. And what I mean by that is I ask them critical thinking questions around the topic of the week to help them think more deeply about their own paradigms around, for example, around research, or ask them questions around what they perceive the problem to be to help them see that there are multiple perspectives to that problem. So one is that they do these journal posts. The second is they do a facilitated discussion. Each student takes responsibility once in the semester to facilitate their entire cohort for learning, so that's a learning community. And then a paper. They have 3 papers that are due that build upon each other throughout the course.
Great, thank you for that explanation. And now I'm going to turn it over to our next speaker, Mike Stutes. Mike, are you there? See, I can't hear you. Sorry about this. Mike, are you able to call in via your phone? Sorry, one moment, please.
Okay, can you hear me now?
Wonderful. Welcome.
Okay, great. I apologize for the technical glitch. If you can hear me okay, I'm very glad. My pulse rate is almost back to normal. As I was listening to the wonderful presentation Christina gave us, I looked down and I'm logged out of the webinar, and then I looked down again and my computer has lost internet connection. So no pressure there. But we scrambled to another office. So thank you for that interesting presentation on what seems like a wonderful class. I want to start off by thanking Delta Omega for this recognition and award. I'm going to share with you about a project we've been working on for a while here at East Tennessee State University. And that's Project Earth, an innovation in education and an education in innovation. Now, Project Earth is employing available resources to improve health. And that's the umbrella of several things that we'll discuss, 3 things we'll discuss today, and several projects we have here at ETSU. So this started about 6 years ago. So we're going to be talking for about 20 minutes, so that's 110 days per minute if you're taking notes out there. So day 1. With the support of the Nice-Longer Foundation and Hope Through Healing Hands, we had some of our students, both undergraduate and graduate, doing field placements abroad. Silas Tola went to Sierra Leone. Beth O'Connell went to Rwanda. And they both came back and talked about how much they had learned from those situations and how they had worked with water. And they had both worked with biosand water filters, and we thought that was the most fundamental part of public health they could be working on. The only problem we had was that we had not taught them how to work with biosand water filters. So about this time, Eastman Chemical Company donated this facility you see now. It's a 140-acre, what was a research farm, to the university. Well, that got us thinking about, could we help our students prepare to go into the field and take on some of these health challenges? And this led to a 15-week course called the Essentials course, and it teaches the essential skills, strategies, and expertise necessary to improve and advance low-resource settings. Our dean, Randy Wyckoff, is a acronym ninja. Thought this course would be useful in several settings. One is in an isolated area without basic services, following a disaster situation with displacement due to these disasters, and for Peace Corps volunteers, mission workers, anyone going into these low resource settings. In this course, the students learn to build with Adobe bricks. They learn to make ropes. They learn to plant tire gardens. They learn to build using low resource materials. So as you can see, it is a true hands-on course. Here's a rust pump that they made.
Yeah. It works. That's awesome. Oh man, I'm so happy.
Now that was the first time those students had ever seen a rust pump, really didn't know how it worked, but they spent the day creating that rust pump with low-resourced hand tools. And you can tell that at the end of it, there was a lot of excitement. And after years of teaching, I haven't had too many students stand up in the back of the class and clap and shout when something goes correct. Now, employers have been telling us that they want students with technical skills. We need strong technical skills, but also the cross-cutting skills. Now, after teaching the Essentials class a few times and having students at the site, we learned that it really wasn't just the technical skills they were learning. They were being put in a situation where they could develop creativity, problem solving. They could work in teams outside of what we do in the classroom. They could actually work in teams that had to solve a problem on paper and then solve that problem with their hands. And if their solution didn't work, they would have to recreate that and keep working with it. And we learned soon that professionalism, communication, teamwork, problem solving, creative thinking, innovation, these cross-cutting skills were the real products coming out of the Essentials course. While the technical skills were there, it was these cross-cutting skills that are so hard to teach in a typical classroom setting. So as word got out with the Essentials course, we had more and more groups wanting to come out for a shorter experience, either a half a day or a 3-day experience. So we developed the skills experience, the shorter term knowledge, immersion, learning, and leadership skills experiences. Now these vary from a short term, a couple of hours of creating Adobe bricks, all the way up through a 3-day or 5-day pioneer experience. I want to share with you a couple of these experiences, starting with the Tortilla experience. And this is where the students come out and they actually make a tortilla. A lot of times when they come out and we tell them they're going to do this, they have this face of disappointment. They've heard all these great things that they get to do here, and they think they're going to pour some flour out, add some water, and make a tortilla. But we tell them they need to do everything it takes to make a tortilla. And this includes clearing the ground, planting corn, making a fence, creating the rope, building a mold, building an adobe stove. Then once the stove is finished, they cook their corn in the stove, they grind the corn, and they cook the tortilla after they've washed their hands with a hand washing station. And then they serve their tortillas. Now, if you can look at that on your screen, it's not exactly a Taco Bell product. But for the first time, we're always very happy with these tortillas. The takeaway for a lot of the students is they've spent 6 hours and they've created about 100 calories of a flour pastry. They also come to understand how much effort it takes to do these things. And some of them have never had these opportunities to clear land, plant, and actually process and cook like this. So most of the time we hear the students say they leave with a true appreciation for what it takes to create a simple food item like this. Second experience I'll share with you is the refugee experience. Now this one starts off with a group of people coming out to the facility, and we tell them they're going to have 50 refugees at noon, and they need to plan and be ready to take care of these 50 refugees. And everyone does a great job. They go through the list and they come up with what they need. We give them money to buy their materials at Uncle Randy's Mercantile. And they have to decide, is it worth buying a rake over Augmentin? Is it worth buying Skittles over a pot? And they go through our store and they come up with what they need. Now, a lot of times you think, well, the exercise is over. We did our planning. We prioritized. We had some strategic decision making to make, but no, now they keep going and they actually set up their refugee camp. They have to set their pharmacy up, they set a medical tent up, they dig sanitation lines, they put tents up, they serve Rice Krispie treats, and at the end of this period they have a whole working refugee camp. But to add that real world flair to it, we have things happen during the setup. Now these include a tree falling on one of our workers, they have a lost child, they have explosive diarrhea victims, we have angry villagers come over and tell them they need to relocate, we have a thief to come in and steal their pharmaceuticals. So now the cross-cutting skills really come into play. You're doing your pharmacy, your clinic, you're setting up your shelter, your sanitation, but now you have to stop and deal with a thief, a medical emergency, the cultural aspect of neighbors coming over not wanting your refugee camp here. And we see this is the culmination of the technical skills and the cross-cutting skills. So we take the technical skills and we add on top of those the cross-cutting skills throughout the refugee experience and all of the skills experiences. The third phase of Project Earth we're talking about is a doctoral seminar course. This course puts doctoral students at the facility, and they're given a health challenge and low resource materials. This student made a spinning wheel out of a recycled bicycle. We have shoes, and we have an experience with shoes. How do you make shoes for people with low resources? Now, these may not look like the latest Nike shoes, but these students may have been given an hour or 2 hours and limited resources. So how would you make a pair of shoes? And then we talk about all the health issues related to not having shoes. We're making fuel briquettes, how we can make a fuel that is better suited for indoor cooking and can be made with recycled materials. And again, the students are given the challenge, resources, and they have to be creative to solve the problem. Now, while these students may never make fuel briquettes, we hope they take this same, and we've seen them take this same problem-solving strategies, creativity, innovation into hospitals and health departments. And when they're presented with a challenge there, they use the same approaches to solve those problems. And here's a group carrying water around the world as a major issue. Here's how to heat with solar power. A group made a solar heater that goes in a window and provides heat for low-resourced areas. Here's a bicycle, washing machine. Okay. Now, one of the last things I want to share with you is where we teach. And we've talked about low resource settings. We've talked about some students going abroad. We talked about the problem solving and everything else these students learn from this. But we wanted to come up and see, could we develop a way that students could experience some of these settings from around the world and in low resource settings while still on property? So what we came up with was a village where they could see firsthand the challenges, where we could take the lessons learned in the essentials course and put those into actual use, and we could stage certain real-world problems in a real-world setting. Not a tabletop exercise, not a rendering on a computer, but an actual real-world setting. Now, we have a video talking about our village, acronym NINJA once again, our village, and it encompasses everything we're doing in Project Earth. So I'll share that with you now.
When Eastman donated the ETSU Eastman Valley Brook campus, we quickly realized that this represented an incredibly valuable resource. I'm not aware of any other school of public health in the country that has access to resources like this. This allows us to have a platform where we can teach innovative courses, we can apply skills, we can bring in community members, we can make a real difference in the health of this region and the education of our students. The first part that we've been doing for several years is to learn the skills. We have the essentials course. We have a variety of a few hour to a few day training programs. We brought in high school kids all the way up to the leadership team of a local hospital. But at the end of the day, we realize we have to make sure that our students not just have the skills, but that they can apply them. And this is where the Niswonger Village becomes so important to us.
We're able to go from theory, from paper, from notebooks, to hands-on experience. We talk about health systems. We talk about health challenges, both domestically and international. Then we try to develop interventions and programming to improve health outcomes. We try to change environments, how we could maybe change policies, change public law to improve health outcomes. But here, they're given the chance to go to the next step. It's building teamwork, creativity. They're out here possibly in the elements. They can see each other's strengths and weaknesses. They learn to help each other. They learn to leverage those strengths. These are all things that we wouldn't be able to do without the village.
So the way to think about the Niswonger Village is as a public health simulation lab. Our job here is to create the kind of situations that challenge our students to use creative thinking, problem solving, teamwork, and innovation to really make a difference in people's lives. Go into this house and make it safer for a toddler. Go into that house and reduce the risks of an elderly woman falling. Go into the village and do a door-to-door malaria education campaign. So the key point is to understand that this is a simulation lab. We're creating real-world experiences, but what we're really doing is teaching our students creative thinking, problem-solving, teamwork, and innovation.
It was the coolest experience ever. I got to really get dirty and use my hands and create this awesome, cool, different experience that I never would have gotten, I don't think, anywhere else. Most different approach to teaching, and it's the most hands-on and real world and applicable thing that I've ever seen.
All of these houses are actual replicas of houses from around the world, so that's really neat to see that people live in this mud shack that we're working on, and people live in this scrap metal house. I came from a very privileged life, and even in the area that we are here, there are a lot of disparities in healthcare that can be helped, but that no one is really focusing on. So being able to build these houses and prepare not only for us to be in a global setting, but being able to say, we're going to come across people who live in houses that are maybe not mud shacks, but they're going to be very low resource, and these people are not going to be very healthy, and they're not going to have access to the best health care like I do. So it definitely puts things into perspective.
It's not just a matter of replicating something that someone else has done or going through a role-playing scenario, as important as those are. I really want to teach the students to be able to identify problems and come up with creative solutions to address them. One of the things we're most proud of with the support from the Niswangers is the fact that we share with them a commitment to improving this region, whether it's improving the education or health outcomes, and we're really trying to prepare students who can make a difference wherever they go in the world. It's really exciting to be here at the launch, but the launch, as with anything, is just the beginning. What I'm really looking forward to are the thoughts, ideas, and suggestions that other people have on how we can provide an even better learning experience out here. That, to me, is the really exciting platform that we're launching from today.
I'd like to take this opportunity to thank the Niswangers for their support for the village, and to thank ASPPH for the opportunity to share Project Earth. And with that, I'll turn it back over to Sarah.
Thank you so much, Mike and Christina, for sharing all about your courses. And I want to encourage all of the participants to please submit their questions or comments via the question box. And then we'll open it up to questions now. All right. This was asked, do you have any recommendations for faculty members who'd like to replicate in some way what you do at the Niswanger Village, but do not have a village and land to do that on?
Well, a lot of times with weather or anything else, we may do a mini refugee experience or something, and we may do it in a room still at the facility. But if someone had a room that they could use as a laboratory, and you had materials that could be in there for students to use, I think a lot of things it just depends on the outcome you want to have. But if you're looking at creativity and innovation, given some materials in a little space and then letting students have their time to experiment, I think it could be done in numerous settings. And I failed to mention one of the things that we've learned that is so valuable in this, and it can be done in a small setting, is letting students fail. Without failure, you can't have creativity. And we tell our students that a lot of times we want you to fail. And the way our academic systems work, we certainly don't encourage students to fail, and sometimes we frighten them so much of failure that it's not even a consideration to them. I think this could be done in a smaller setting, maybe not on such a grand scale.
That's great. Now, failure, that's a scary word for, I think, a lot of our students at our graduate schools programs. How many students have taken this Essentials course so far?
we are on the 4th cohort of undergraduate students, so we're approaching 150 students approximately.
And have you made any changes from the first run through to now, and what is your vision, ultimate vision for what this course could ultimately become?
Quality improvement is written on every wall, it seems. If something doesn't work, or even if it does work, we'll have an after action meeting, and we try to change what we can to improve the situation. We ask all of our participants and students what they received from it and how it can be improved. So we've made several small changes, maybe a couple of large changes. What we'd like to see out of this course is where the students as undergraduates develop these basic skills, and then throughout their master's and doctoral programs, there are other doctoral students come in and do research. We had one of our students researching water filters and how to make a low-cost indicator for the quality of water. So we hope that the essentials course is just the start, and then as they progress, they become more researchers, and we solve low resource health challenges.
Wonderful. Well, I want to say thank you to both of our presenters today, and certainly enjoyed learning about your courses and all the great things you're doing at your respective universities. I want to remind everyone who has participated that this webinar has been recorded, and it will be available on the ASPPH website in the archived event section soon. You will all receive an email with a link to that recording when it is available, and this has been approved for 1 hour of CPH continuing education credits. And please stay on the lookout for future webinars, ASPPH Presents webinars that are always listed on the ASPPH.org homepage as well as the events page. And lastly, before I release you all to the weekend, a reminder, our registration is currently open for the 2018 ASPPH annual meeting and the Undergraduate Public Health and Global Health Education Summit taking place in early March in Arlington, Virginia. Thanks again to our presenters today, and have a wonderful weekend.